Hi, Christy. My name is Emily. I'm a student physical therapist from UNLV, and I'm going to be doing your eval today. How are you doing?
I'm doing good.
Good. So I saw in your intake form that you've been having some shoulder pain.
Yes.
What's been kind of going on?
It's my right shoulder area. I kind of messed it up and it hurts now. Mostly it just kind of like aches at the beginning, but then throughout the day, the more I use it, it just hurts more and more. By the end of the day, it just is uncomfortable.
Yeah.
A lot of it is when I'm moving my elbow around a lot. I'm a fourth grade teacher, and so writing on the whiteboard is a lot. And by the end of the day, those multiplication problems, they're
They
hard.
get ya.
Yeah,
So they're hard on the shoulder.
I'm just looking for someone to help with the pain.
Yeah. Okay. Well, I'm sure we can find something to help, and I have a few more questions just to give an idea of what's going on, and we'll see what we can do so you can get back to doing those things you like, and maybe the multiplication will get a little easier too.
Okay.
So I saw in your intake form that you go to the gym a lot, and you've also been painting your house. That's kind of how your pain started. Was there one moment at the gym that you felt like it, like all of a sudden was really painful, or has it just been over time it's gotten worse, the pain?
I would say it just has been over time. There's not like a moment where I just knew that I messed up my shoulder. It just felt like I got home from the gym and it just was really achy.
Yeah.
And it was very sore, and then ever since then it's more noticeable, and like I don't start as good as I was, and then I end off worse than each time.
Yeah, that makes sense. Okay. Also, I'm just going to be taking notes as we go, so I make sure I don't miss any details later. Okay, so it's kind of gotten worse over time. It's an aching, kind of numb, dull pain. Have you had any tingling, or does the pain move to any other areas on your arm?
It's just sharp. Like when I raise it, like basically there, like it's fine doing this, but then just going above that 90 degrees, or like going back, really hurts.
Yeah.
But like as long as I keep it there, mostly if I'm just not using my shoulder, it's fine. But it just when I hit that point, it's just sharp.
Okay. Sounds good. So no moving to other areas, just it's staying all over your shoulder.
Yeah, it's just the shoulderish area. So I just kind of been avoiding it as much as I can.
Yeah. Okay, that makes sense. Besides avoiding movements that aggravate it, have you been doing anything else to help manage the pain?
Yeah, since I don't use that often, if I do realize that it's hurting, I'll try and like ice it.
Does that help?
Yeah, it does, and then I'll sometimes take like ibuprofen or Tylenol to help because sometimes that helps.
Okay, good. Does your shoulder ever feel stiff, or do you have any catching, or does it feel unstable, like kind of like it's gonna fall out of its socket? How would you describe?
I don't know, it just kind of hurts.
Yeah. Okay.
Yeah, I don't know. I think it just kind of, when I move it and then it hurts, I just try and stop moving it because I don't want it to hurt more. So I don't know if it does those things, because usually I'm getting old enough now that I don't want to push it.
Yes, that makes sense. Okay, awesome. So just a few more questions. Okay, so I also saw in your intake form that you have a shoulder injury on your left side a couple years ago. Do you have any problems with that anymore?
No, I injured it a couple years ago playing hockey, but it's been fine since. I don't notice it at all.
Okay. Okay, you also mentioned you've been having some pain during the day and at night. Does that pain wake you up at night, or is it just kind of sore?
It's sore, but it's fine. I just kind of like readjust and then I go back to bed.
Changing position helps it then.
Yeah.
Okay, great. Okay. Okay, so I think I just have a few just more general screening to make sure there may not be anything else going on. So have you recently had any headaches?
No.
Okay. How about any lightheadedness, impaired cognition, or changes in your vision?
No.
Okay. Have you had any nausea or vomiting?
No. No, just in my shoulder.
Okay. No unexplained weight loss? Any chest in your pain or in your abdomen?
Mm-hmm.
Have you had any shortness of breath, like besides exercising? Just
No.
when you're going about daily? Okay. I know on your form you listed the medications you're on. Have you ever had a history of high blood pressure?
Not that I'm aware of.
Okay. Never had that from the doctor. Have you ever used corticosteroids?
No.
Okay, that's great. And then any walking or balance problems?
Mm-mm.
Okay, awesome. Well, that's great to hear. All right, I think those are all the questions I have about your shoulder. So now for this next part, I just wanted to see how your shoulder's moving, and hopefully that can help us figure out better what's going on. Is that okay?
Yeah.
Okay, so let's just start. I just kind of want to see how things are moving. You can stay here in your seat. But let's start with your neck, and let's just bend it forward for me. And then go back. Good. Look side to side. As far as you can go. Good. And then do a side tilt. Okay, awesome. That looks great. Now let's move on to your arms. And I know you mentioned some of these movements are painful, which by the way, is there anything besides over the head and kind of twisting in and out that's bothering it? Any other movements?
No, just if I use it a lot.
Okay.
So the first couple exercises might be fine, but later on.
Yeah, just over time, you don't really have that endurance. Okay, so let's just start by raising your hands up over your head. Okay, and then come out to your side, like airplane as high as you can. Is that kind of sore on the right side?
Mm-hmm.
Okay, let's bring your arms. Can you bring them up again to here and go down? Up.
Yeah, that kind of hurts.
That kind of hurts right there. Okay. What about going backwards? Does that hurt at all? On both sides? Sorry, you can scoot your chair out if it's in the way. That's pretty good. Can you bring your hands behind your back?
Yeah.
Okay, great. All right, let's have you move up to the table now. You can go ahead and let's have you lie on your back. So I'll move these chairs out of the way. I'm just going to make a few more notes here. Okay. Get these chairs out of the way. So now I just want to measure that range of motion because I noticed as we were moving through that screen you had a couple areas where the right side was maybe not moving quite as far as the left side. Nothing too crazy. But I'm going to have you go ahead and lay down with your head on this end of the table and your feet on that end. So I'm going to start with your left side, since that's your good side. And the first movement I want to do is some shoulder flexion. So that's when you raise your arm up above your head. So go ahead and try that for me. Okay, awesome. Bring it back down. I'm just going to line up my tool now. Is it okay with you for these tests? I'm going to need to touch around your shoulder area. Is that okay with you? Okay, and I'll kind of explain these tests as we're going. So So I'm just gonna find some landmarks. Okay, so go ahead and try raising that arm all the way up by your ear as far as you can go again. Good. I'm just gonna add a little extra pressure now. Okay, go ahead and relax. We'll do the same thing on your right side. So can you just go ahead and show me how much movement you have on that side? So lift your arm up.
It's about where it's just comfortable.
It gets kind of tender, but you can go a little farther. Okay, let's bring it back down. Okay, let's try that one more time. Just go to where it's uncomfortable though. Right about there. Okay. I'm gonna apply just a little more pressure. You let me know if it's too much though.
Probably right there.
Right there? Okay. Go ahead and relax. I'm gonna make note of those numbers. Okay, this next one is similar, but we're gonna try that out to the side movement again. Okay? So go ahead and let's see that range of motion. Good, okay. So let me get this lined up. Okay, let's see you come out one more time all the way up to your ear. As far as you can go. Right there?
Right there.
Okay. I'm gonna apply just a little more pressure.
Okay.
Okay, great. All right, let's do the same thing on this side. I know this might be uncomfortable though, so just bring it up to your ear as far as you can go. Right there?
Yeah.
Okay, I don't want to make you do it too many times, so I'll just grab that measurement right there. Okay, I'm gonna go just a tiny bit right there.
Yeah.
Okay, go ahead and relax. Okay, we just have one more. And for this one, I'm going to measure your internal and external rotation. So I'm going to bring your arm out to the side here, just like that. And then I want you to try to go as far as you can down, like this. And then we'll go back up, and then we'll try going backwards. Okay? I left my tool over here though, so let me grab it. Right, go ahead and go down. Great, come back up. And then go back down. And apply some extra pressure. Okay, great. Alright, I know this might be a little tender on this side. Is that okay right there?
Mm-hmm.
Does it cause too much pain?
Mm-hmm.
Okay. Let's do that same thing. Go ahead and bring your hand down as far as you can go. Right there.
Mm-hmm.
I'm going to apply a little more pressure. Okay. Bring it back up. And then let's go backwards. Okay. Right there.
Mm-hmm.
Okay, one more time. I'm going to apply a little pressure. All right. Okay, you can relax. I'm going to write this down. Alright, so now we're going to move into just a few more. So I'm actually gonna have you flip onto your stomach now. And we're gonna do something similar to what we just did. So if you could actually scoot a little closer. Yeah, that's probably good right there. So we're gonna kind of do that similar robot motion of bringing your arm in and out. So I'm gonna place this towel under your arm. Is that comfortable? Okay, maybe actually scoot back just a little bit. Perfect. Okay, so I'm gonna bring your hand up right here in this position. Is that okay? All right, and I'm gonna apply some pressure to your wrist right here. Your job is to not let me push your wrist down, okay?
Okay.
All right, ready, go. Push. Nice. Okay, we're gonna try the same thing, but now we're gonna bring your arm forward. So you can let your arm relax. We're gonna bring it right here. Okay, can you hold it right here? And now I'm gonna apply some pressure here. Don't let me push it down, okay? Ready, go. Nice, good job. Nice and strong on that side. Okay, we're gonna do the same thing over here. I know this one might be a little more tender though. Okay, bring the arm back as far as you can. Same thing, don't let me push you down. Push. Okay. Bring it up. Same thing, don't let me push your hand down, okay? Okay. Great job. You can sit up now. Won't have to do any more up and down. Okay. So the next test I want to do, we kind of already did this motion once, but I just wanted to see the ranges of where you're getting your pain. So I'm gonna have you just sitting on the edge there. Go ahead and raise your arms out to your side, all the way up to your ears. So let me know when you start to have that kind of aching, catching pain.
Right there.
Right there. Can you go up any higher?
Yeah, but it would hurt.
Yeah, okay. That's fine, you can relax. I want to see how your shoulder blades are moving. So if you don't mind, are you okay to lift up the back of your shirt so I can see your scapula?
What?
Yeah, just like that. Is that okay? Alright, so now what I want you to do, I'll kind of hold your shirt up so I can watch, but I want you to first just slowly raise your arms straight up and then bring it back down, and then we'll do that same thing but slowly bring them out to the side and back down, okay? I'm just going to watch your shoulder blades here. Okay, ready, go forward all the way up. Okay, great. And then back down. And then go out to the sides. Okay, awesome. Back down. Let's do that one more time. I'm gonna give you some weights. Okay, and same thing. I'm gonna watch your shoulder blades. So go ahead and bring those arms straight up. Whenever you're ready. Okay, and then bring it back down. And then out to the side. Okay, great. You can go ahead and relax. All right, we just have a few more tests. I know I'm probably wearing you out, so I'll try to make you not suffer too much longer. So, I just have a few more I want to do. So let's have you bring your right arm up to this position. Is that kind of sore? Okay. And I'm going to apply some pressure right here on the front. Don't let me move you Okay. Okay, and now we'll do the same thing but the other direction. Okay, great, and relax. Still doing okay? Okay, this is our last one. I'm gonna have you bring your arm up in front of you right here. I'm gonna apply some pressure to your wrist. Don't let me push your arm down, okay? Well, let me push it down a little. Are you feeling pain?
Just the soreness.
Yeah, where are you feeling it?
Right in here.
Okay, and where did you feel on that last one when I was pushing you right here? Okay, nice. Okay, you can relax. That's our last one. Okay. Thanks so much, Christy. I know that probably wasn't the most enjoyable, but you can go ahead and have a seat again. Alright, Christy, so it does look like you have some muscle weakness in your shoulders. The shoulder's a pretty complex joint with lots of muscles and bones working together. And it looks like some of those muscles have some weakness in them, which is okay, but when they're weak, then the pieces don't all work together how they're supposed to. And so it looks like you have some tilting with your scapula, and that weakness in your rotator cuff muscles is probably causing some impingement and causing that shoulder pain that you're having, especially when you do those overhead movements. But the good news is we can totally work on that and totally fix that with physical therapy. So my plan kind of moving forward, and I want to hear your thoughts, is we can have you come into therapy 2 to 3 times a week for maybe the next 4 weeks, depending on what your schedule is like. And as we progress through those weeks, we'll reevaluate your shoulder, see how it's doing, if it's improving, what other problems we're still having and challenges. In our visits, we'll do this today and also in future ones. I want to do some mobilizations, so that's moving the joint through the correct pattern so that you're not getting that pinching in your shoulder and that's causing that pain. So we'll do that mobilization to help the joint move smooth again. And then we'll also do some strengthening of those muscles so that they can kind of pick up the slack and work how they're supposed to so that shoulder joint can move more fluid again. Does that make sense?
Mm-hmm.
What do you think of that? Does that sound
Yeah, we can make
like a
that
good
work.
plan?
Yeah.
Okay.
My shoulder feeling better.
Yeah, definitely. Like I said, thankfully this is something that can be improved and we can get you back to the gym. So I think for now you can still go to the gym, do other exercises, lower body, your other shoulder. But let's cut back a little bit on the shoulder exercises for your right arm for now. I'll give you some here in PT that you can do at home and at the gym on your own that will focus on those shoulders, muscles that we're trying to strengthen without aggravating it more. Let's avoid some overhead movements for now, and then also you can keep doing heat and ice and Tylenol as you see fit to help you manage that pain. But do you have any questions for me? Does that sound like an okay plan?
Yeah.
Okay.
Yeah.
Awesome. Well, it's great to meet you, Christy, and great to work with you, and I'm excited to help you get back to work and working out.
Perfect. Thank you.